Hypertension versus kidney disease. Introduction. It's unfortunate that so many people have lost their lives because of high blood pressure, hypertension. This happens mostly due to its asymptomatic nature. It's also on record that high blood pressure is a leading cause of kidney disease and kidney failure, end-stage renal disease. Blood pressure. Blood pressure is the pressure of circulating blood on the walls of blood vessels. Blood pressure is usually expressed in terms of the systolic pressure over diastolic pressure and is measured in millimeters of mercury, mmHg, above the surrounding atmospheric pressure. Normal resting blood pressure in an adult is approximately 120 mm of mercury systolic, and 80 mm of mercury diastolic, abbreviated 120/80 mmHg. Prehypertension is a systolic pressure of 120 to 139 or a diastolic pressure of 80 to 89. Hypertension is the persistent increase in blood pressure with a systolic pressure of 140 or above or a diastolic pressure of 90 or above. Kidney. The kidneys are two bean-shaped organs, each about the size of a fist. They are located just below the rib cage, one on each side of the spine. Every day, the two kidneys filter about 120 to 150 quarts of blood to produce about 1 to 2 quarts of urine, composed of wastes and extra fluid. The urine flows from the kidneys to the bladder through tubes called ureters. The bladder stores urine. When the bladder empties, urine flows out of the body through a tube called the urethra, located at the bottom of the bladder. In men the urethra is long, while in women it is short. Don't forget to like, subscribe and drop comment below, this help us to serve you better. Each kidney is made up of about 1 million filtering units called nephrons. Each nephron filters a small amount of blood. The nephron includes a filter, called the glomerulus, and a tubule. The nephrons work through a two-step process. The glomerulus lets fluid and waste products pass through it, however, it prevents blood cells and large molecules, mostly proteins, from passing. The filtered fluid then passes through the tubule, which sends needed minerals back to the bloodstream and removes wastes. The final product becomes urine. High blood pressure can damage blood vessels in the kidneys, reducing their ability to work properly. When the force of blood flow is high, blood vessels stretch so blood flows more easily. Eventually, this stretching scars and weakens blood vessels throughout the body, including those in the kidneys. If the kidneys' blood vessels are damaged, they may stop removing wastes and extra fluid from the body. Extra fluid in the blood vessels may then raise blood pressure even more, creating a dangerous cycle. Symptoms. Most people with high blood pressure do not have symptoms. In rare cases, high blood pressure can cause headaches. Kidney disease also does not have symptoms in the early stages. A person may have swelling called edema, which happens when the kidneys cannot get rid of extra fluid and salt. Edema can occur in the legs, feet, or ankles and less often in the hands or face. Once kidney function decreases further, symptoms can include appetite loss, nausea, vomiting, drowsiness or feeling tired, trouble concentrating, sleep problems, increased or decreased urination, generalized itching or numbness, dry skin, headaches, weight loss, darkened skin, muscle cramps, shortness of breath, chest pain. Diagnoses. Kidney disease, when found early, can be treated to prevent more serious disease and other complications. High blood pressure is diagnosed when multiple blood pressure tests is repeated severally and shows that a systolic blood pressure is consistently above 140 or a diastolic blood pressure is consistently above 90. The National Kidney Foundation recommends people with high blood pressure receive the following regular screenings. Blood pressure tests. Urine albumin. Estimated glomerular filtration rate, eGFR. People at risk for kidney disease due to high blood pressure. Kidney disease caused by high blood pressure affects. However, certain people are at higher risk. People who have diabetes. People with a family history of high blood pressure and kidney disease. People who abuse drugs, some painkillers, herbal medications e.t.c. People who apply toxic cosmetics, mercury-containing cosmetics. People with poorly treatment urinary tract infection. Prevention. Prevention of kidney damage from high blood pressure include keeping your blood pressure controlled. Make sure you get your blood pressure checked on a regular basis. Eat a proper diet. Get moderate exercise, such as walking, 30 minutes daily. Avoid smoking. Take enough rest and avoid too much stress. Take the medication your doctor prescribes. Treatment. For patients who have high blood pressure and kidney disease, the most important treatment is to control your blood pressure through lifestyle changes. Treatments needs to be individualized. Therefore, patients are advised to see their doctor for the right prescription which they need to adhere strictly. Also, it's recommended for patients to always patronize certified healthcare providers in order to optimize treatment. Finally, we are encouraged to regularly check our blood pressure to avoid the ubiquitous effects of hypertension to the body, which are most times asymptomatic until grave damage are caused. Thank you for watching. Please subscribe, comment and turn on the notification button.